Hey guys, so in this video, I'm going to go over kind of what you need to do in the morning as far as chart review. And so this is, after you open a patient's chart, this is kind of the first view that you'll see, the family med view. If you want, you can change it to the hospital view. Here is the default, but so the first thing that you kind of do is if there are any patients who are unstable, and you would kind of know that based off from what the night team might tell you from sign out, or if a nurse tells you that a patient's unstable, definitely go see the unstable patients first. Um, and this is kind of just how you triage the list in general. And then next, see the potential discharges for the day. And then lastly, see kind of just all your other patients. I'm honestly not the best at doing that, but that's kind of the best way to go about um, seeing kind of the order of seeing patients throughout the day. Um, let's see. So I'm going to kind of go through the steps right now of how to do a thorough chart review. And then one thing to keep in mind is as you're doing this, and this might be kind of something more advanced after you're been doing this for a few months, but as you're kind of going through the chart, be thinking of what your plan is for the patient or how kind of different things that we're looking at here are going to change your plan. So the way, and there's pretty much you can do it in any order that you want. I'll just give you kind of my approach. So the way that I think about the morning chart review is I break it into like two categories. So first is kind of subjective things as far as like what other people have said about the patient, as far as other doctors, the attending or the nurse. And then lastly, I look at the objective information. So the first thing that I do is I go under documents and then I'll look at the attending's addendum if I didn't already from the day before, because the attending doctor will write an addendum on your note, and then sometimes there's like additions to the plan that they didn't tell you, but they put in the note. So make sure you read that, and they kind of expect you to read that too. And then if there's any like consult notes, read those or any other notes from other uh, doctors seeing your patients. And then I always kind of keep it like default on this view where you see all the physician notes. You can also change it to just all notes. So if you want to see like the physical therapy notes or case management notes, what's the other one? If you want to see like telemetry strips, whenever a patient's on a cardiac monitor and there's like an abnormality, then generally the telemetry people will kind of take a picture of that and then put it in this note so you can look at those. But generally, I kind of just keep it on the physician note unless I specifically want to look for something else. So I look at those to see what other doctors have said. Then I come over here and go under patient story. If you don't have this, then click here and then you can just add it to this top tab. But I click patient story. This is just a test patient, so it doesn't show anything here, but probably half the time the nurses are gonna write, maybe 75% of the time, like nurses are gonna write a little sign out when they're done with their shift, or if there are any events over their shift of kind of like, hey, patients like doing okay, or like, hey, patient had this event overnight, and then they'll write a short, just like a 2 sentence summary of what happened during their shift. So that's pretty helpful to read that. I would definitely read that every morning on all your patients. And then lastly, I go down here and look at the MAR. That stands for medication administration record, the MAR summary. And so this is a huge thing. I think a lot of times people overlook this, but um, this tells you what medications your patient has gotten and then is also scheduled to get for that day. And so I've seen, and I think we've done kind of M&M things as well, kind of on this, to where the problem ended up being that people weren't really checking the MAR, and then medications weren't being given that should have, and kind of vice versa. So this is, I would say, one of the most important things to check. Um, for example, say the night team gave your patient, like say your patient had an episode overnight and they gave them a certain medication. They may have forgotten to tell you or forgotten to write a cross cover note, and then you can come in here and then kind of see if any medications were given overnight. And then also just make sure that your patient's getting the meds that you want them. Like say they're supposed to be getting an antibiotic every morning and their Lasix medicine, make sure that's actually on here and it's scheduled to be given today or for the day. And then I usually leave it set to all medications. You can also switch it to just active ones. Or let me see. So I leave it here and then it just grays out anything that's inactive. And then it puts them in order. So scheduled meds are here, PRN meds are there. And then at the bottom, it has like infusions and drip, like a heparin drip or IV fluids. So yeah, so that's the MAR. So that's kind of the first section of my chart review. And then the last half of it is looking at objective data. And so most of it is going to be on this screen. So I kind of start with vitals. I look at the extended ones, and then I go back at least 48 hours and just see if there's any red flags. Obviously, this patient doesn't have really vitals logged. You'll see like elevated ones in the red, the low ones in blue if it's a low value. I generally scroll back just kind of quickly and look over the last 2 days and just to see, because sometimes your patient will spike a fever and then that's kind of always a red flag in the hospital. So I look at that and then I look at the extended labs. And then this patient doesn't have too many labs, but I look at those. You can also look at recent labs. The extended lab makes it so that each kind of interval here is like a single day, like 24 hours. Like, so all the labs they had on this date, whereas this one is any lab that they had during that time. So this one's important to look at for glucose checks because you can see, and this test patient hasn't had any glucose checks, but it'll say like throughout the day, because they check them every 6 hours in patients with diabetes, it'll say like kind of show you what their glucose trends have been if you need to change their insulin regimen. Then you can look at any pathology results, microbiology, and then it shows like blood cultures, urine cultures, and then any imaging. And I kind of always just click through most of these, even if I know, or even if I wasn't aware that, or say like even if I didn't order a certain test, because again, like another doctor or the night float people may have ordered, say, an X-ray on your patient overnight and then not told you, and then you can look and see if there's any new images that people took overnight or anything. Let me see. Oh, and then lastly, as far as kind of this objective data, you can look at I's and O's. If you go to the hospital's workflow, you can look at the I's and O's. So this is, and it doesn't show it because it's a test patient again, but it puts a pretty nice graph here and shows you like how much fluid intake and urine output they've had over the last 24 hours. It's not always accurate. Generally, they have to have like a Foley catheter for it to be completely accurate. And sometimes the nurses don't log it, so that's why it's inaccurate. One other one that may be useful to know about is if you click here on the interactive view, you can find how many liters of oxygen your patient's on. It's always best though just to go in the room and see for yourself, but most of the time the nurses will log it. It'll say like 2 liters of oxygen via nasal cannula or whatever. Let me see. So I think that's kind of the biggest, kind of all the things for chart review. So just kind of in summary, I would say, let me see. So kind of in summary, I would say when you get your list in the morning, see the most unstable patients first. If there's kind of any issues or you're worried about what to do or worried about the patient, kind of come up with a plan quickly and then run it by the attending. Like say like, hey, I think this patient maybe needs to go to the ICU because they're satting in the 80s. Can you come look at them? Then see your potential discharges and kind of get things going on them, and then see the rest of your patients. The next big highlight for this video was looking at the MAR. Make sure you always check the MAR. And then kind of the last point is as you're going through all of this and doing your chart review, make sure you're coming up with your plan. And so kind of after you close this chart and move on to the next one, don't just write down the like data, also kind of synthesize it and come up with a plan. And I think that's helpful to do even before you see the patient. You can come up with a pretty good plan of like, hey, like their haven't had fevers, they're off oxygen at this point, like we're planning on discharging them, or like we're planning on stopping their IV fluids, or whatnot. Oh, and then one other thing, and I'm going to make a video about this for these two topics, but two things that generally you can do as an intern, or you can request that they do it as the med student, is if you're going through the labs and you see electrolyte abnormalities, or you see that their glucose levels have been really abnormal, you can just go in generally, if you feel comfortable, and change those orders without waiting for rounds, because you need to kind of jump on the electrolyte replacement and stuff early. And I'm going to make a video on that, but that's pretty simple to do. So there's some kind of simple things, or if your patient's on IV fluids and you're like, hey, they really shouldn't, and it's kind of clear that they shouldn't be on IV fluids, right when you check at 7 a.m., you can just stop them if you feel comfortable doing that, or ask the senior resident or the attending. So, all right, I think that's it for this video.